Kaduna has been the trailblazer in terms of setting the standard for other states to follow in terms of the healthcare budget allocation over 15%, and also the accountability mechanism to ensure that service delivery remains optimal. So a round of applause again for Kaduna State. Thank you.
So on behalf of Nigeria Health Watch and Gender Health and all of the other partners who came together to put this policy dialogue together, I'd like to say a big welcome. Thank you for making the time to be here. We're very aware of all of the competing priorities that you had to battle to be here. So thank you very much. We do not take that for granted, and we look forward to fruitful deliberations and to what comes out of this dialogue.
The state has taken important steps in managing the Basic Healthcare Provision Fund to channel resources directly to primary healthcare facilities. However, we also understand that sustainability is not guaranteed by funding alone. It requires transparent disbursement and tracking mechanisms, community participation in budget planning and monitoring, and a commitment to result-oriented spending. To ensure this, we are exploring models such as state-level health trust funds, performance-based financial pilots, and the integration of community-based health insurance schemes to improve equity and reduce out-of-pocket expenditure, particularly for the poor and vulnerable in our population.
Apart from our community engagement strategy, we also do misinformation management. This is where we deploy our community listening to understand what the rumors and the myths and the misconceptions in the communities are that we need to address. We're also partnering with Kenya, Uganda, and Ghana to have a cross-learning and experience sharing, especially working with other civil society organizations and health and advocacy organizations like ourselves.
What are the bottlenecks that you're encountering in making sure that funding gets to primary healthcare centers and it translates to improved service delivery?
There's an issue around liquidity, availability of funds. You understand? Sometimes you actually get your approval, you get even your release, but cash piping becomes an issue. However, the good news is that we're getting reports that the Kaduna State Revenue Service are reporting an increased internet-generated revenue. So we're hoping that moving forward, we'll see some improvement in that. But like I said, the process are layered and you could get disruption at every point. Thank you.
Just share your thoughts in a quick 1 minute. How Kaduna State can better mobilize resources, leverage innovative financing models for primary healthcare delivery in the states.
Like I said, the cash planning. We need to have this kind of training. It's like chain from the Ministry of Health or health sector. You understand? Once an approval is gotten, to plan and budget commission, to finance, we all have responsibilities, all have some work to do in trying to achieve the health financing. So prioritization and cash planning is key, it's very important, and we need training in that.
So I'd like to hear more in terms of specifically, when is this rolling out? What is the number that we're looking at? And just, what is the expectation? You have an idea of what the expectation is, especially. Could you just speak?
Now, you talked about numbers. We did a gap assessment, the state, to assess the gaps at the primary healthcare level, for human resource for health, and the secondary healthcare level. The last time we did it, we needed a minimum of 4 times as many nurses as we have in Kaduna State to actually plot that gap. And then you need a minimum of 2 to 3 times as many doctors to handle the human resource for health gap. But because of recurrent attrition in and outside the state, because of those we lose from retirement, those who die out, the numbers have continued to shift. Now, the second part of your question was how soon will that come back? How soon will it come to fruition? His Excellency the Governor has actually declared that recruitment is to commence.
So are we prioritizing midwives in this recruitment?
Yes, we are prioritizing midwife. Just to give a clearer picture, we require 2,272 midwives, but at the moment we only have 500. So it means we need all the midwives we can get to, beat down the maternal mortality.
Thank you very much.
So I would like to know what policies have been put in place to ensure there's no balanced budget anywhere in the world. However, the little that is being able to accrue to these facilities, how well are they utilizing it? And what sort of financial reporting framework are put in place for them to ensure there is accountability and transparent use of these resources? Thank you very much.
We currently have a platform called the phctracker.org, and in this platform we have over 200 facilities that are being profiled. You can visit the platform. It's called www.phctracker.org. You can visit the platform. You can check what your community is saying from the services that are